What people don't realize is that when the doctor refers you for physical therapy and he gives you the big long list of places to go, that there is a difference between physical therapy clinics. What we do here at Omaha Physical Therapy Institute that's unique is we provide one-on-one care with the same physical therapist every single visit. So every time the patient comes in for their session, they're going to be seeing the same therapist, and the whole time is dedicated to them. Something else that we emphasize with our therapists, our staff in general, is just clinical education and keeping up with the most scientific and current research. Weekly, we have a meeting over lunch on Wednesdays where we dedicate an hour or two to discussing the most current and relevant treatment interventions, techniques. We talk about case studies, maybe some patients that we're having difficulty with, or patients that we've done or we've had success with, and we want to share how we obtain that success.
No, I think that's a good point. I think one of the things that we really take pride in is the science behind the physical therapy we provide. So I think we do an excellent job of working with patients and creating a fun atmosphere and just making sure everybody has a good time when they come to physical therapy, which I think is a big part of it. But I think one other aspect we excel is we really look at the science behind the therapy that we provide and make sure that it's fully supported by science, current modern pain science. Make sure that everything that we perform on a patient has been supported via research, so we can kind of talk to the patients and say, okay, we're doing A, B, and C because of the fact that what we've seen out there in the current literature supports what we're doing. We're never going to be billing or practicing on patients things that aren't supported and aren't proven to be effective. And that's one thing I know that Katie and I and Claire take great pride in, is always staying up to date with the current research and making sure that we educate each and every one of our patients that comes through the door about that research so they know exactly what we're doing and why we're doing it.
And something else too, I think that makes us unique in the Omaha community, well, in general in the physical therapy profession, is we have a lot of patients that come in and they're concerned about physical therapy being painful, or they're going to be leaving feeling worse and they need to take their pain medication before they come in. And people need to understand that if they're going to a therapist that is actually causing more harm than good, then that's the body's way of saying, hey, stop, we're pushing it and we may be causing further injury. And so here we have a common philosophy where, let's say you have a post-op shoulder surgery or something like that. We're not pushing our patients through a lot of pain. Now, there's some discomfort with stretch occasionally, but we're not pushing them through that pain because we understand the physiological backing for pain, and we know that sometimes it can do more harm than good if we are pushing them through that. So people need to understand if they're going to come to Opti, they're not going to be undergoing any kind of painful intervention or treatment, and
it should be exact opposite. You should be coming here and getting pain relief.
And feeling better by the end of your session.
That's one thing we can pretty much guarantee, is that we're going to make sure we're trying to get you as pain-free as we possibly can.